pain control. Usually the TENS is for more chronic conditions. So what thermal agent might you see in conjunction with TENS? Heat. It's for more chronic injuries. IFC is for more acute injuries because it can also, besides pain relief, it can improve range of motion and decrease inflammation. So with IFC, what might you see with IFC? Ice. Ice. All right, so the same thing that you do with the heat. You want to palpate to locate the pain. So I'm going to say that Chelsea has pain all across her lower lumbar spine. So what I want to do with my electrodes is I'm going to take the electrodes and try to surround the pain. So usually with the TENS unit, you're going to see 4 electrodes used. Very rarely have I seen 2. Always, and I was telling a lot of people this that I was testing, always ask your patient if you're hitting those painful areas. That's just going to help with the overall effectiveness of your treatment. I'm going to pass these TENS units around so that you can see them. This one doesn't have a battery, so it's not really useful. Make sure when you get these that the unit is off. You don't want to have your unit on before you start hooking your patient up. And you can tell because there will be a light on. So when it's on, the light's on. When it's off, the light's off. Make sure it's off. On page, let's see here. We're going to pain relief chapter first because we're doing TENS. On page 260, in your text, table 13.1, highlight it, put a star by it. Know it and love it. That is what you need to know for testing.
13.1?
Yes. 260, the treatment parameters for TENS and IFC. With IFC, you only have a high beat and a low beat to know, and that's in pulses per second. A high beat and a low beat. And that's that first column. I'll put this in front of you too, so you can see it. So in that first column, it says pulse frequency, and it's that's for TENS and for IFC. So for IFC, all you have to know is that 100 to 150. For the TENS, you have to know the pulse frequency plus the pulse duration. We're going to be doing conventional TENS. If you want to feel what acupuncture TENS is, you can feel that on yourself or hook somebody up to it. Some people like it for pain relief. It tends to last a little bit longer, but it's not the most comfortable sensation, so we don't always do it. You'll see more of the high rate or conventional TENS. There's also, in the middle, once you see the TENS unit, there's 3 choices that you'll have for in the middle, B, C, and M. You want to choose, typically, start with the C. The B is for burst mode, and you'll see on that table there's a setting for burst mode. And then there's the M. So if your patient becomes accustomed or they accommodate to the electrical currents, it doesn't feel as strong. They might have complaints like that. It just doesn't feel as strong as it did when you first hooked me up. If you switch it to modulated for your patient, maybe at the next treatment, it comes in waves and it feels like that. Feel these modalities because you'll better be able to remember and explain it to your patient. It'll come in waves and it takes the body a little bit longer to accommodate.
The C stands for constant.
The C is continuous, yep. So I have my settings. Now, you have the pulse frequency. You can set it anywhere between that 100 and 150 for the TENS. Anywhere between that 50 and 80 microseconds for the pulse duration to make it comfortable for your patient. So if they don't feel the sensations as well, or are you seeing a muscle contraction, because you don't want a muscle contraction with this, then you can play around with those settings and go somewhere in between. All right, Chelsea, I have you all hooked up here. I'm going to turn both of these on at the same time. I think your patient, you can do it one at a time, but I just like to do it at the same time so they're getting like an even feel throughout the electrode. So this is just to her tolerance. So I'm just going to ask her to tell me first when you feel the sensation. It'll feel like vibrations underneath your skin. Who has had TENS? What would you say it feels like? Sorry.
Kind of a little bit prickly.
Prickly? What would you say, Dave?
Yeah, let's see, like a tingling.
Tingling? I've heard like when your foot goes to sleep, it kind of feels like that. It's like a buzzing sensation. What would you think?
Well, I'm just asking, are you doing the duration right now? Are you starting
I
now?
set the phase duration. I set the pulse frequency. I set all of that up.
So does it start, do you put 100 to 150 in, or are you just putting 100 in, or like how does that work?
Anywhere, so you can start anywhere between those. So
Okay.
once you get the TENS unit, you'll see there's no necessarily 100, it's a 35, and then it jumps to 135.
Okay.
So, and then it goes, the highest number is 150, so just somewhere in there.
You just put it in there, but like, I don't know, depending on how they feel
Mhm.
when it does it?
Yeah, anywhere between those settings, you'll be in the green zone, the safe zone.
Okay.
All right, so I'm gonna turn both of these on at the same time. Chelsea, let me know when you first feel it, okay? You want this to be a strong, it shouldn't be uncomfortable at any time. You wanna make sure you have good contact with the skin with your electrodes. Always have good contact. If you don't, you can have a chance of burning your patient. In these videos, you don't want to block everybody else, Chris. You can sit down or something so that you're not blocking other people. There's videos on the computers as well. I don't mind you taping me, feel free to tape me, but be mindful of that. You can feel it now. What would you say it feels like?
Just kind of a tingling.
Tingling sensation. Okay, so I want it to be strong but comfortable, okay? So tell me when to stop.
We can stop.
Okay.
Whoa.
So, I'm just gonna leave you here for this and I'm gonna catch up on mine. One thing I like about TENS is that it is portable, so you can hook your patient up, have them maybe sit for heat or something like that, and then they can keep it on and do some of their exercises.
How come I feel more on the left than the right?
Do you feel more on the left than the right? Okay. Some of your patients will feel like that. You can make adjustments. So you can see that these leads right now, I'm doing a parallel pattern. So what that means is I have an electrode here. Sorry, my squares are just awful. So I have squares surrounding her lumbar spine. I'm using a parallel pattern. So I have one lead that comes here and is attaching to the TENS unit and here. If she was telling me, and that's because I said her pain is throughout her back. If her pain were right here, more pinpoint, then I could do an X pattern so that my current is focused where she's having that pain. But I'm doing a parallel pattern because she has a bigger area that I'm trying to treat. So I'm going to see her left side, you said is more than your right? So I'm going to adjust this side. Feels more powerful on the left than the right. Okay, and you want that evenness, so ask your patients, what, does it feel like it's hitting, does it feel like it's on both sides?
What did you just change the?
I
Is
changed
there
the
a left,
intensity.
right? Oh, okay.
Yeah, so if you look on those top knobs, those are the intensity knobs. And that's the one where I showed you if they're on, if they're off, they're off. I don't know what I did with my thing.
I have a question, if we're applying heat,
Yeah, yeah, you did. Yep.
we're applying heat also,
Mhm.
and obviously after 5 minutes, you have to go check for the heat,
Yes.
the sensation.
Yeah.
Does that mean we're going to have to remove those electrodes to check under there too?
Great question. No. So if you were applying both at the same time, if I were applying this TENS in conjunction with heat, the first thing is you want to apply the heat before you turn the electrodes on. So let me say that again so everybody writes that down, because that's important. You'll fail for this. You want to make sure the electrodes are off before you apply heat, all right, or any modality. You don't want to change, if you put something on while they are on, including any type of pressure, whether it be from a hot pack, whether it be from your hands, any kind of pressure can change the intensity that your patient is feeling. So you have the machine off, you apply the hot pack, then I'm going to turn my intensity on, where I have my lights going on. At my 5-minute mark, I can lift up without turning off my machine, check her skin, and then apply it. What you don't want to do is conform it to the area.
You just place it on
You
there?
just lightly place it on there.
Okay, so like you said before, obviously like the pads could come off because of motion or something like that.
Yes,
So if that happened, you would have to turn it off before you put it back on them, because obviously
Yes.
that would be
Yes.
applying pressure.
yeah. So if you see at 5 minutes that one of your electrodes doesn't have good contact, turn the machine off. Make sure that she does have good contact before you apply that
Because
heat
obviously
again.
if you just took it and put it right back on, that's fail, right? And if it's still on.
If you,
If one of the pads came off
yes,
and it's still on, I just put it right back on, it's over.
yes.
Okay.
Because what you could do is not only, you'll remember because you'll shock yourself, but you can also shock your patient. When you guys are practicing, if you forget to turn off the intensity, it'll only take one time because it's a pretty good shock. I've done it before, just moving too quickly, and you'll never forget. Let's see, there's something else I was gonna say about that with the application of. So check your electrodes, they always have to have good contact with the skin. TENS operates on the gate controlled theory of pain. So, what does that mean?
It overstimulates the nerves to block out the pain.
It overstimulates the nerves to block out the pain. So your patient has pain and it kind of tricks the brain. These vibrations, your brain starts concentrating on these vibrations. So you're stopping pain, you're gating that pain at that spinal cord level. So it doesn't have a chance to transmit up to the brain.
I have a quick question.
Yes.
So at the beginning of your application, you should set your parameters to the lowest setting, or how do you kind of gauge that in terms of per person?
Yeah, you can use the lowest setting. So if you wanted to do your pulse frequency and you would document it like this. So it's 100 PPS. Your microseconds, your phase duration is between 50 and 80. So I would do 50, and it looks kind of like a M or a U, and it's microseconds. You need to have what the parameters are. So it's pulses per second, and it's microseconds. So that would be how I would document her treatment today. And you can kind of guesstimate. It's hard because they don't have numbers. Are those units still going around? So you can see that the numbers on there aren't always clear. So you're kind of just guesstimating about where you are. These can be, insurance companies will pay for patients to have these. If your patient does have these, they can be worn up to 24 hours, but it's not recommended. Why do you think?
Increase the chance of burns or the pad falling off.
The burns, pad falling off. What happens if you do something all the time? Your body gets used to it. It's not as good as what it was in the beginning. So before they feel like they want to take medicine, pain medicine or something like that, have them put the TENS unit on. They can wear it, 20 minutes or more, up to an hour, and then take a break. If you know that they're going to be working, they can wear it at work for 8 hours and then take it off when they get home. Something like that to help with their overall pain, and hopefully they won't have to take any pain medicine or as much of a need.
Can they still use that with pain medication? Because when
can.
we be playing, they would tell us, we don't want you on pain medication because then you won't actually feel yourself if you actually do hurt yourself.
Yeah, I guess you can. There are some patients that I guess will take their pain medications, So it's totally up to you. I tell them when they feel like they want to take a pain med, try putting on the TENS unit because this has less side effects than the medication that they're taking. Yeah. All right, so chronic conditions. Chelsea, how are you feeling? Pretty good? Okay. All right, so like I said, the high beat and the low beat, that chart, table of 13.1, IFC, the only things you have to know are the pulse frequency. You're going to set the high beat for 150, and the low beat for 100. That is all you have to set for IFC. That is all you have to set, is that first column, pulse frequency. For the conventional TENS, you're going to go all the way down. So you need to know the pulse frequency, the pulse duration. The amplitude is going to vary per patient, and it's not anything you really document. You don't want to see a muscle contraction with this or with the IFC. No muscle contraction. And like I said, we won't be doing acupuncture TENS, but if you want to feel what it feels like, you're more than welcome to. Now, when you're turning this off, the biggest problem that I've seen is shocking your patient. And let me have you feel what modulated feels like so you can kind of explain it to them. You feel it different? How would you explain it?
It's like a wave.
So it's more difficult for your body to accommodate to when it comes in waves on this modulated versus continuous setting. Always try the continuous. If your patient is constantly telling you they are adapting to the current, it doesn't feel as strong, this is something that they would say, then you can switch it to the modulated. Or for home use, modulated is appropriate.
Is that also, sometimes patients don't feel anything until their muscle contracts? Is that a better application for people who have that high?
TENS, for conventional TENS, you don't want a muscle contraction.
Right, and
If you're doing-
IFC? No?
Yeah, and IFC.
Okay.
Low rate TENS, so if you're doing the acupuncture settings, like it would be like an acupuncture treatment, then you do want the muscle contraction.
Okay, what if they get a muscle contraction and they're still, but they like it that high?
Awesome. If you're getting a muscle contraction, and I'm going to turn this down. If you're getting a muscle contraction, you want to, that means you're on a motor point. What's a motor point?
Muscle belly.
Muscle belly. So what you want to do is if you see rather than decrease the intensity and make it a less effective treatment, you should move your electrodes around so that you're not getting that muscle contraction. Because with, again, conventional low-rate TENS, what you're going to be tested on, you don't want to see a muscle contraction. So if you get one, and that sometimes happens, move your electrodes.
Thank you.
Sure.
And make sure to turn it off.
Thank you. What do you think of it? How would you explain it to them, how it feels for somebody that's never had TENS before?
Well, it's definitely tingling, vibrational. It feels good, but it didn't hurt. The waves, comfortable, that's comfortable.
Yeah, I love TENS. If you haven't experienced it, I like it. I like the way it feels. I have a lot of back pain. If I had one, I'd probably wear it, not 24 hours, but I'd wear it quite a bit. It's awesome. When it's flared up, when I have a flare up, you'll see me, especially Mrs. A, wearing the TENS units because we can walk around with it. It's awesome. Sensory assessments, light touch. That's all you have to do with this one. If you are applying TENS in conjunction with heat, then you would do light touch and your thermal sensation. But if you're only applying TENS, specific to TENS, light touch is appropriate.
So obviously for doing both modalities, you have to go do contra and precaution for both.
Yes, and you may see that in your final. Yep, you may see that in your final. You also want to make sure that the skin is intact. So when you're back there doing your light touch or you're doing your palpation, make sure that you're observing the skin. You don't want to place the electrodes over skin that has a rash. You can cause morbid irritation or over any open wounds. Prior to applying TENS? Okay. Contraindications and precautions. Although they have it split in different chapters, the contras and precautions are the same for all of these. So, do you have a pacemaker? Do you have an irregular heartbeat? Do you think you have to ask both?
Yes.
A pacemaker and a regular heartbeat the same thing?
No.
No, so you do want to ask both. Placement of electrodes over carotid sinus. Where are your carotid sinuses? Like in your neck area. You don't want to place your electrodes over the carotid sinus. Areas where there are blood clots or thrombophlebitis is present. And then specific areas with a pregnant woman. You don't want to apply it on their pelvis, their abdomen, their low back, or their trunk. Anywhere where the baby is. I've had students that have come back to tell me that during their clinical rotation, they've been asked to apply E-stim to patients with cardiac pacemakers because the PT hasn't checked. So, and then they're very thankful that the student checked because it saved their license. Make sure that you check. Cardiac disease. Does your patient have cardiac disease? One thing that patients don't always realize is that hypertension has to do with the heart. So you can even ask them that if they have any hypertension or cardiac issues. Sensation mentation, malignant tumors, not benign but malignant, and then areas of skin irritation. For some reason, and iontophoresis, you should know, after other physical agents, it's a precaution. So if you apply heat and then apply iontophoresis, you're actually taking a chance at developing an adverse reaction. So try to apply iontophoresis without any other agents.
There's no choice in just rechecking.
Yes.
So you need, posting this part of it on
What, the contras and precautions?
the slides?
You guys have this one.
Page
No.
246.
But you have all the information. This is a shorter version of what you guys have, because I don't have time to go through it all. This is a shorter version of what you guys have. Contras and precautions are in your book. How does the TENS feel? Like she said, it feels like vibrations under the skin. I've heard patients say that it feels like bees buzzing, but without stinging. Ants crawling, but not biting. If your patient's in a lot of pain and has never had an electrical current, those aren't very inviting words to use, I guess. So vibrations under the skin, like your foot falling asleep, is probably more patient-friendly than these two, okay? Yeah. And feel it. Like I said, I can't express to you enough that you need to feel all of these modalities. I don't want you guys to come to your skill comp and say that this is your first time applying TENS or you've never had a chance to feel it, because it'll help you explain it better to the patient. All right. So when you're applying these electrodes, again, clean skin with soap and water. We will probably have some baby wipes available for you when you guys go into your testing. Want your electrodes at least 2 inches apart. So what happens is, if your electrodes are close together, 1 inch, it's more superficial. The further apart you place your electrodes, the deeper the sensation goes. So if you are getting that muscle contraction, if you separate the electrodes a little bit further apart from each other, hopefully they're going to bypass those superficial nerves and go right into the muscle. So at least 2 inches apart, but no on smaller areas. If they're closer, that you're getting a more superficial current. It's not penetrating as deep.
What do you do with a really hairy dude?
Yeah, it said to cut the hair,
Sure, you go.
Like a tattoo?
You put it on and then rip it off and then put it back on again.
Yes. You know, what's funny is, I've seen a lot more hairier guys. What I see out here is a lot of men like shave their arm hair and leg hair and stuff like that. But what some guys will like you to just peel it off really quick. Others, you wanna try to take your time, but, you just try the best you can to deal with the hair. It's not comfortable, I'll tell you that. Back here, and it happens. All right, again, don't touch the electrodes, when the current is on. All right, so IFC can only be done from these machines. There's this one here, and then there's another one in the lab. Those are the only machines that do IFC. So if you have an IFC scenario or someone that's more acute and you want to use IFC for, then know that you're going to have to use one of these machines. So it's not portable like the TENS units. And I'll pass this one around for anybody. Did everybody get to see the TENS, or some people still not see it?
Yeah, we saw.
You guys all see it over here? Does anybody have TENS units at home?
Right.
If you want to bring it in, feel free to bring it
One
in.
of my comments.
Yeah, feel free to bring it in.
Josh, you guys see all
All right, terminology that you want to be familiar with. And again, this is on your PowerPoint as well as the worksheet that I posted. Accommodation and adaptation. You might hear those words used interchangeably. That just means that your patient has gotten used to the current. They've gotten used to the electrical current, so they've accommodated to the current. Modulation are the steps that you take to prevent that or decrease that accommodation from occurring. So accommodation, adaptation, and modulation. Those are terms that you want to be familiar with. And again, I know I have it on that worksheet. Your treatment parameters, make sure you know those. No visible contraction. You want me to go back? Accommodation, adaptation.
visual contractions are a sign that the stimulation is too strong.
You're over a motor point.
What do you do then? Just move the
Electrodes. Yep, you can try moving the electrodes. If that still doesn't work, then you can go ahead and try to vary the parameters a little bit.
When you do an X pattern, is it more intensified in the center
Yes.
versus?
Yep. So IFC, with the IFC, you only use the X pattern. IFC, you only use the X pattern. With TENS, you can use a parallel pattern, or you can use an X pattern. The X pattern is going to be for more specific pain. So if I tell you my pain is right here, I'm going to use a parallel pattern. So I'm going to surround my pain with an electrode here, 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 and here. And I'm going to do parallel when I hook it up. So I'm going to have my leads on one side and the leads on the other. With the X pattern, I'm going to cross my leads. So you can see I have, these are leads that are coming out from the machine. There's a red and a black one if you guys, anyone has the machine right now. I'm going to cross them so that it makes an X. This goes under the care of the,
I braided them just to make it difficult. Just trying to be efficient.
Yes. All right, so here are the two leads, right? One is black and the other one is more of the brown color. So when I want to make an X pattern, I'm going to take a lead here.
You need an extra set of hands.
Yeah, I'll show you on the board. So X you can use with TENS or IFC. So if I told you my pain is right here, it's right in my spine, or it's right here, then I'm going to take my electrodes and surround and make an X. Because that way, like you said, Josh, it goes more into the center versus being more diffuse. All right, so I have two leads on this side, two leads on this side. When I'm making the next pattern, I have one lead here, one lead here, and I'm going to use my other ones, one here, one here. It doesn't matter where the black and the red go, just that you're crossing them and making that X. Intended?
Yes.
All right. Clinically, your treatments are going to last 20 minutes, just like a hot pack. Very much in conjunction with it, you'll see it quite a bit. Educate their patient. If they see any redness underneath the electrodes, if they have any irritation underneath the electrodes, make sure you give the clinic a call and let us know. Yes.
I'm looking at this and, I see the settings say 0 to 5, but I'm wondering.
That's the intensity. That's the current amplitude. So that's what you turn up to get that sensation of tingling from your patient.
Right, so I'm wondering, how would I know where between 100 and 150 I am?
So if you open up the case, then you'll get to your pulse frequency and your pulse duration. So if you open it up in the front,
No, that's the one you're on.
and on the actual TENS unit.
Oh, I see.
So here is where you're gonna set your machine, in here. These knobs up here are for the intensity, so when you wanna turn it up for your patient, for them to feel that sensation, you're gonna turn these knobs. These are the current amplitude.
What's the amplitude?
The amplitude is on top.
And then the.
Your settings go in here. There's a PR or the hertz, that's gonna be your pulse frequency. The PR or the hertz, where your PPS is, that's gonna be your pulse frequency. The PW is the pulse width or the pulse duration. That's going to be where you do your 50 to 80 microseconds.
Say that one
What
more
was
time.
the second one?
The PR is the pulse rate. That's going to be your frequency. There's also a HZ there for hertz. That's all frequency. And I have you guys look at that on that worksheet to define what these are. The pulse width is going to be your phase duration. That's where your microseconds are going to be set.
Phase duration or pulse duration?
Pulse duration, phase duration, same thing. You'll notice if you don't have it, say if you're testing and you have it on the burst setting, because these will be all messed up. They won't have the correct settings. We'll mess them up so that you have to know what you're setting. See how it's blinking? What will happen is you're going to see those muscle contractions, and it won't be very comfortable for your patient. I've seen it where your patients are like this.
I've had that happen.
Yeah. So this is not where you want to be. You want it to be at the continuous. So pay attention to what you're setting. It'll be like this. Like this. You don't want this. You don't want this.
So blinking is burst.
Blinking is burst, and it'll
What
cause
does
the muscle
modulation
contraction.
look like?
What does modulation look like? It's just a continuous. It just feels different to your patients.
Right.
That ends, it doesn't matter if it's fast right now, since I'm turning it on.
Nope, because there's no, I don't have the electrodes on, so there's current coming through, but they're not going anywhere because there's no electrodes. Yep. And then these will tell you,
What
this
is
will
burst
tell
mode
you,
used for?
so you want to make sure you practice these, because I just turned these all the way up. You want to pay attention to which way the arrows are going, because this is going to increase the intensity on your patient and cause your patient to scream or make a grimace during testing. You don't want that to happen to you.
When she said that she didn't feel as much on the left side, that's what you changed just
This is,
on
I
the
just
one
changed the
side.
intensity, yep, because I had the parallel, so I had one side over here, one side over here, and I knew which one. If I were gonna do the X pattern, I'd have it crisscross. Yeah.
It doesn't matter which color is on which side, right?
Nope, doesn't matter.
What would burst be used for?
Acupuncture or low rate TENS, or that burst setting like it has in your table 13. Alright, so TENS and IFC. TENS is more chronic, it decreases pain. IFC also decreases pain, but it can benefit your patients that have those cardinal signs of inflammation because it can reduce inflammation and help improve overall range of motion. IFC would not be wrong under chronic condition because they have found it to provide a longer duration of pain relief. So clinically, you can use IFC in chronic conditions as well. Some people like it a little bit better. However, remember, we don't have the portable units. So clinically, if you want your patient to work out You can have them hooked up to the TENS and still work out, versus having to be hooked up to a machine. Oh, what's that?
So essentially, TENS is just a portable version of IFC.
Without all the effects. TENS doesn't do anything for inflammation, TENS doesn't do anything for range of motion. It's strictly pain relief.
Does it feel any different?
I don't think it does. Has anybody had IFC and TENS? No, not the same time. I have, I think it feels the same. It still has that buzzing sensation. I think it feels the same.
If it goes deeper then, is that what?
They say that the pain relief lasts a little bit longer.
Yeah.
Nikki?
For testing reasons, like if the scenario says it's a chronic condition, you want us to use TENS, correct?
Yes.
Okay, yeah, vice versa for
Yep.
IFC.
But clinically, nurse know that you could use IFC, if it were. Yeah, you may have an acute, condition where you would wanna use IFC. Yep. And then remember, X marks the spot on page 13, or 260, figure 13-1. I just gave you that. There's another picture of X marking the spot. It's in that first initial chapter, right before muscle contraction. Page 225. That top section, A, picture A, on figure 11-3, that's IFC. So you're crossing it, so where that black line is, that's where most of the current is going to be felt. Same with TENS, if you cross it, the current's going to be felt more in the middle. There's a better picture than my pretty sad drawings. All right, so you have this patient here. This patient sustained injuries in an accident 5 days ago. Patient reports 8 out of 10 vein in the low back. The plan of care includes modalities. What would you use?
IFC.
TENS because he's doing modality.
Why would you use ICE and IFC?
Acute.
It's acute, it just happened 5 days ago.
Would it be wrong to use TENS? Could you use heat?
Yes. I would.
Hmm?
You could.
You could use heat?
Yeah.
Is heat a contra or precaution for acute inflammation?
Caution.
It's a precaution. So more than likely you would see ice if there were what was present?
Cardinal signs.
The cardinal signs of inflammation. When you're palpating, you feel heat. They're very stiff. You know that they've lost some range of motion, some overall function. They're increased pain. Those would alert me that I would probably use IFC and ice. But it's very, you wouldn't be wrong in using any of them as long as the patient is benefiting. But that's what we want to see is acute, you'd go here, chronic, you'd go here. Clinically, you might use either one. Maybe these machines are taken up by 2 other patients and all you have left is TENS. Transdermal drug delivery. I'll have something else for you on iontophoresis. You want to make sure that you take a look at it. We don't have any drugs that we're going to be delivering into each other. So this is just more for your knowledge and for when you go out into the clinic. All right. Nmes in Russian. Love, love, love this. So, all right. I need a victim, I need a patient. Christy. I'm going to make Christy wave at you. What I love about IFC, or not IFC, but Nmes, this Russian protocol, it feels weird, but you get such great results. So patients that haven't been able to contract their muscles, you're able to get a contraction from them. This is the modality that you want to be aware of your muscles. You need to know your muscles and where your muscle bellies are. That's going to help you because you'll get a better contraction. When you're doing Nmes, make sure that you're on the right channel. I've seen students that have tried to figure out why this keeps turning off on them, and usually it's because they're using the wrong channel. So check your channels to make sure that you're in the right place. I'm gonna say that
Machine
again.
does both IFC and Nmes.
Yes, it does. And it does ultrasound. It does a lot. All right. So it's the other ultrasound unit out there too, that looks kind of like this. It's a different brand that does the IFC. You turn it on, you can see it has the electrotherapy, ultrasound, it has combination. We're gonna go into electrotherapy because that's what we're doing. Then it asks you IFC, and it has an X there to remind you that X marks the spot. It has Russian parameters. You can also go into re-education parameters, but we're going to be doing Russian right here for her, and I'll show you. Re-education is pretty much the same thing. All right, so with this one, you are probably only going to use 2 electrodes versus the 4 that you'll see with TENS and IFC. And to get the most effective contraction, usually your patients are going to be really weak who have Nmes. So you want to contract for them. That way you can palpate to see where the muscle belly is. So I'm just going to bring her up because I want her to do this motion. I want her to wave. Now, what if I go down by the wrist? What's down here? Is that muscle? No, it's starting to get more tendons and things like that. If you place it there, it's not going to be very comfortable for your patient. So again, knowing your anatomy, where your muscles are, is going to benefit you for this skill comp. All right, so I'm just going to palpate around, and I'm going to try to find her muscle belly. And what I'm feeling for, I want you to feel on each other. Go ahead and feel each other. Take them up into wrist extension and feel that muscle pop up underneath your fingers. Are you guys feeling it? You feel the muscle pop up underneath your fingertips? That's what you're looking for. That's the muscle that you feel popping up is the muscle that you want to target because that's what's controlling it. And we have this whole extensive group here. Now, it's a little bit harder on the arm, especially when you're dealing with females, on trying to get it 2 inches apart. So for this one, I have it a little bit closer, but my current is going to be running a little bit more superficial, which is okay because I want a muscle contraction. So I'm going to try to make her wave. Let's look at the parameters in the book. So the parameters that you need to know, this is good for edema control. You can use it for strengthening because you're getting that muscle contraction so it can act like a pump. So 247, table 12-1. 247, table 12-1, right next to the contours and precautions that we talked about. Yep, 150 to 200 for small muscles, 200 to 350 for large muscles. Know the difference. What am I treating here? Is this a small muscle group or a large muscle? Small muscle group. All right, so I'm going into my Russian settings. I'm going to go into edit. So I'm going into electrotherapy, then I hit Russian. Now I'm going into edit. It'll ask you what one you want to adjust. So right now, my duty cycle is at 50%. The duty cycle is the same as the amplitude. So you see that it says 10% of MVIC and 50% of MVIC. MVIC means maximum voluntary isometric contraction. It says it for you down at the bottom of the chart. So if your patient is uninjured, like a stroke or something like that, then you can use that 50%. If the muscle has been injured, like with surgery where it's been cut or something like that, you can use the 10%. What that means is the amount of contraction will be more comfortable for the patient. And then you can progress that as they get better. So I'm going to leave mine at 50% because Christy hasn't been injured. My burst frequency is the same as my pulse frequency. It's in that PPS. So right now I have it at 50. 50 is about the medium. So what I might see when I would adjust this is if you get a contraction that's jerky, where you're getting a contraction in that motion that you want, but it's not a smooth contraction, I would adjust the pulse frequency. Higher. To smooth it out. And see, you have anywhere between 35 and 80, so you have a lot that you can play with. So I'm going to leave it at 50 here. The cycle time, they recommend on the on and off time ratio that you initially use a 1 to 5 ratio. What that means is she's going to get a contraction for 10 seconds and then she's going to rest for 50. So it's a 1-5 ratio. Why do you think you give that rest period? Give her a chance to relax. If I do it at a 10-10 or I don't give her as much of a rest period, I'm going to fatigue that muscle. Because I don't want to wait 50 seconds for you guys to see her beautiful contraction, I'm going to do a 10-30. If I had someone who was very spastic, I could use a 10-10, so I'm just constantly trying to fatigue that muscle. But I'm going to do 10-30, and for your testing purposes, if it's the first time, I'm going to do a 1-5. All right, so, Christy, your amplitude is down here. What I want you to tell me is when you first start feeling some tingling. What I'm looking for, this will make your muscles contract, and you should feel your hand pull back. I don't want it to be uncomfortable. It does kind of feel like it's a pull, but let me know when you first start feeling it, okay? Now, I want to watch my patient's face, and I want to watch her arm because I want to see that muscle contraction. But I also want to make sure it's comfortable for her. How's it going today? Don't want to turn it too fast because if I go too fast, I could go higher than what I want and cause her pain. So I'm going to just take it up nice and slow, but not too slow. You're feeling it in your thumb? Is it uncomfortable? Just a little tingly? Okay. Feel it? Just go with it.
What are you at right now?
The thumb fully, and I can barely start to feel it a little bit in the top of the arm, but not the rest of the hand. Oh my gosh, that's creepy.
I'm going to hit start immediately.
How come her thumb goes
She's
in?
lying.
It's where I have the muscle. So what muscle would cause her thumb to kind of go in like that? That's on the, that could be located.
It's a flexor, right?
It would be a flexor.
Adductor pulse, something like that.
Yep. So I'm getting a good contraction. I can adjust it a little bit. So if that's uncomfortable for her thumb to be like that, because sometimes it can be. Let's watch this next contraction and see what it looks like.
30 seconds and then it'll go.
30-second off time, and then she's going to get another contraction.
Once you go up to
It feels really weird.
what's
The
your pulse
worst,
frequency right now?
the pulse frequency, I have it at 50. I have my pulse frequency at 50. And that's the automatic default.
The activator C7.
Alright, so I'm going to adjust this and see if I can get a better contraction, because I don't like the way her thumb is moving. So I think this one is can you see that this one is a little bit more medial? So I'm going to make it a little bit more lateral and try to get a better contraction.
Would you have to turn off your machine for that typically?
Yes,
Yeah.
because again, if you touch these when the current is going through, you're going to get shocked.
So did you pause it, or did you do something?
I turned it off.
Oh.
Yep. Also, when you're placing these, you want to try to make the electrode parallel to the muscle fibers. So knowing which way the fibers run will also make your contraction a little